So now that we talked about the difference between allergies and a viral cold, how do you treat allergies? Well, basically with anti-allergics. Now, before I go into anti-allergics, the best way to get rid of allergies is by avoiding whatever gives you those allergies. So keep that in mind. There's nothing that will cure your allergies if you keep getting exposed to whatever's causing the allergy. Now, to explain a little bit on what an allergy is, it is when the body reacts in an excessive way to any particular allergen. Could be, for example, famously dust mites, dog dander, cat dander, cockroaches, things like that. And so when your body is allergic, just a little bit of those substances will make them produce a lot of runny nose and possibly even itchy eyes. You could get hives and some other allergic symptoms. Now, it's important to make the difference between that type of reaction from an allergy and that same reaction or similar because of irritation. Fumes can irritate the nose, temperature changes can irritate the nose, and just in general, a large amount of particles can irritate the nose. And that is not necessarily allergic. For example, if you're playing with a dog and it happens to be very hairy and maybe he's dusty and you're kind of playing around and you get enough of that inside your nose, then you're going to start sneezing and producing a lot of mucus. That's your natural body response to all those particles getting into your nose, but it's not necessarily an allergy. So sometimes to differentiate people that have just very sensitive noses to environmental factors from those that have actually allergic responses, there's allergy testing that can be done in some doctor's offices, including mine, in which we prick the skin and we look at the reaction. And depending on the reaction, we can, to some extent, tell you and predict how likely an allergy to that particle is. Dog, cat, tree, grasses, weeds, etc. So in the treatment of allergies, the mainstay is going to be anti-allergic or antihistamines. That's what everybody commonly knows, Benadryl, Zyrtec, Allegra, Claritin, all those, Xyzal, all those are antihistamine, and they block the histamine trigger for allergies. There's also anti-leukotriene or leukotriene inhibitors actually that will block the leukotriene trigger for allergies. And that the only medication that really gets used in children is Montelukast or Singulair. Then we have steroids. Steroids will always decrease inflammatory responses, and allergies is an inflammatory response, so steroids will also help with the treatment of allergies. In that respect, we have the nasal corticosteroids, Flonase, Nasacort, Nasonex, and many others. And they're used mostly in the older population. They used to be used only on 12 years and up. Now the indication has come down all the way to 2 years old. And if your pediatrician approves so, we also use it in smaller children for a brief period of time with no complications. And that's how you treat allergies. One more thing that I can recommend if you're suffering from allergies is to also do sinus rinses. When you get up from bed, flush your nose to get any allergen that you picked up from the night, from the pillow, the dust mites, etc. And then when you get home from being outside, flush yourself or your kid's nose with saline to get all those allergens out, and it'll help decrease the amount of reaction. Thank you for your attention. Please comment below any questions that you might have. Share this so that other people can also be informed. And I look forward to your questions and answering them. Take care.